Pupillary assessment is an important part of neurological assessment because changes in size, equality, and reactivity of the pupils can provide vital diagnostic information in the critically ill patient. This is a quote from an article titled Neurological Assessment, Part 2, Pupillary Assessment by Nursing Times. Checking pupils is done in optometrists, places of work, hospitals, and ambulances. It is done to check the responsiveness of patients if they are unconscious and to make sure that the optic nerves and eyes are not damaged. When pupils react, they can give information. For instance, if a person's pupils are bilaterally pinpoint, which means both pupils are pinpoint, it can mean that they have a pontine hemorrhage or have opiate use. Another example is if a person has dilated pupils. If a person has dilated pupils, it can mean that they have used drugs recently or have just visited the optometrist. A fun fact from Troy Bettinghaus's article titled Pupil Size and Your Health on the Very Well Health website, 20% of people all over the world, only 20%, have anisocoria, which means unequal pupils. It is important when checking pupils to follow the PEARL rule. PEARL stands for pupils equal, round, reactive, and to light. For instance, it is important to follow them because pupils, it is important to check that the patient you have is not blind and that their eyes are still working. Equal means that both the pupils are the same equal size and that there is nothing wrong with the optic nerve of one certain eye. Round is to make sure that the person's pupil is not cut or damaged in any way, and an example of a slitted eye would be a cat eye or a snake eye. Reactive goes hand in hand with to light. Reactive is to make sure that when shining a light for checking pupils, it makes sure that the eyes will dilate or go pinpoint when shined by light. Now I will call upon an audience member to demonstrate the 6 steps on checking pupils. An audience member, please. The first step when checking pupils is to explain what you're doing. I'm going to be checking your pupils. Just a moment. Number 2 is examine each eye individually. Make sure that they're both the same now and that nothing is wrong with them before you start. The third is to retreat from the patient and to look at both eyes as a whole and to make sure that, again, nothing is wrong with either one of them. The fourth step is to shine a light, a flashlight or a pen light, onto one eye and make sure they pinpoint and to make sure that they have a reactiveness. The fifth step is to shine a light on the same eye and then check the other eye to show that it is reactive on both optic nerves. Step 6 is to repeat all the 5 steps before, but with the other eye. So again, we look at both eyes, we look at them individually. Now we will take the flashlight, shine it their eye, take it away to make sure that the pupils will dilate, and then check the other eye. Thank you. Right. If you need a more direct or a longer video on how to pinpoint, on how to check pupils, there is a video on YouTube called How to Check Pupil Reflexes Responses, Consensual and Direct Reaction Nursing Clinical Skills by Registered Nurse RN on YouTube. If there's anything you should take away from this video, it is to remember PEARL.